like to introduce first, all of you know, I assume, what this panel is about, since you're all here for a reason, one way or another. We have two Bens here. To my right is Ben Chin, although he's really to the left, and Ben Gilman, who should be over here. But positions, it depends on what way you're looking at positions. I'd like them first to introduce themselves and a short, very short bio, and where they stand professionally or otherwise on the issues that we're dealing with, which is a very important healthcare initiative and a very controversial one. Generally, issues that are controversial in the state often wind up as initiative measures, and I think this is no exception. So why don't we start with Ben 1 and Ben 2?
Okay, so is this the 10-minute?
No, just introduce yourselves.
Okay. So I'm Ben Gilman. I live in Orem with my wife and my 4 kids, and my 2 parents who are 80 years old also reside with us in Gorham. I grew up in Westbrook. Went to my undergrad and went up to Orono for 4 years, then came back down and went to the University of Maine School of Law, graduated from the School of Law back in 2001. I worked for Senator Olympia Snow for a few years, then started getting into some association work, and now work for the Maine State Chamber of Commerce in Augusta, representing Maine's business community on different issues around the state. Right now, in my capacity as I've left that capacity, I'm on loan to the No One Question 1 campaign, and that's why I'm here this evening to discuss why we think we have several issues with this campaign with this issue that we'll get into.
Ben 2.
Cool. Thank you. Thanks everybody for being here and for the library for hosting, and Ben and Bruce, it's really good to be with both of you. My name is Ben Chin. I live in Lewiston with my wife and 2 kids, 3-year-old, 1-year-old. And I'm also the campaign manager for the Yes on One campaign. So that's what I'm mostly focused on. But when I'm not also kind of similarly on loan, I'm the deputy director at the Maine People's Alliance. So we're a grassroots community organization of 32,000 members in Maine. We've got environmental issues. We've helped pass the minimum wage in 2016. Medicaid expansion last year, and just work on a number of other things that sort of touch the lives of everyday folks and try to find solutions to move our state forward.
I really want to thank the library, and I'm a Scarborough resident, for hosting this today. My background, to make it short, is I am not a Mainer, I'm from California. And I have, however, lived here since 1989, I guess, and have taught at USM in the Muskie School for about 29 years. I do have 2 sons, one of them's right there, smile, and a second one who are both Mainers, although I understand that doesn't fully qualify, but certainly more so than I do. In a session like this, it's important, I think, to have a small set of ground rules. And those ground rules generally are let people talk. This isn't like sitting around a table at home, everybody. And let people talk. And we will be asking you not only to ask questions, but to put on 3x5 cards issues that you have in your own mind. We'll start off in this session with 10-minute presentations. If they want to make it shorter, fine. If you want to make it longer, that's okay too. But not much.
Okay. Cut me off at 10.
I gotta get my glasses for the rest of this. And what we'd like to have both of them do, and I think they will because of their roles in this issue, and this is a very important initiative, in the state. Coming from California, for which Wisconsin invented the initiative process, where I spent several years teaching. But California, I think, really turned it into, some call it a circus, but that depends on where you live. But a lot of the important legislation in this state, certainly since I have been here, has been through the initiative process. It it's an interesting state in the sense that the legislature can play a very, very important role in shaping what that initiative measure is. If you happen to smoke marijuana, you would understand exactly what I mean by that. It really has been shaped as much by the legislature relative to important implementation issues as the origination of, in fact, the initiative for Maine to move at least recreational in that direction. So this is a very important process. It is a process that, looking at it as a political scientist, which I was, it involves key, correct me if I'm wrong here, key institutional questions as to how do you shape a commission, which is part of this initiative, which would guide this process. The funding, which estimates, correct me if I'm wrong, about $300 million. And of course, the perennial issue, where does the money come from? And the general question is, should the state move in the direction of providing support for healthcare professionals dealing with senior citizens? There's a whole variety of issues that interact with one another. And so I'm sure that both of our presenters can give us a good idea of how those issues come together to shape what will be a very, very important initiative measure that Maine citizens are voting on in Maine. So at this point, I guess I could flip a coin. Does either one, if you want to begin?
You go first, you're the yes side, or?
Sure, whatever.
Okay, that's a very diplomatic thing.
Yeah.
Okay, go ahead then.
Sure. Well, really great being with all of you tonight. I might start by just asking, anybody in the room ever been a family caregiver? So someone who's taken care of a loved one who's older or a child with disability? Anybody ever had that experience? Okay. Yeah, so that's about right. About 6 in 10 folks in Maine are doing that. And that number is only going to increase by 2030. Over 1 in 4 people in our state are going to be over the age of 65. So we know the country in general is, as the baby boomers retire, is going to be dealing with more and more aging issues. And Maine is at the forefront of that trend. And to start with a quick story, I think that illustrates the challenges that we're going to face in some of that. Last summer, my grandmother got diagnosed with a terminal form of cancer. And so she was in the hospital for a pretty severe treatment. And then she was just kind of in this iffy stage of we weren't quite sure how much longer she was going to be. But it no longer really made sense for her to stay in the hospital. So all the family had gathered and we were kind of figuring out plans for what to do next. And obviously there's a whole grief process that's happening at that point in time, and you're wondering what's gonna go on, but you're relieved that she's actually gonna last long enough to get outside the hospital. But it isn't moving so quickly that she's gonna be in hospice. So we want to go home, except, and that's where my grandpa is and that's where she wants to be. But she can no longer bathe herself. She can no longer use the restroom by herself. There's a pretty long list of things that she used to do around the house that my grandpa relied on, and he's not in great shape either, right? So then the question becomes, okay, so grandma's obviously going to go home, but how is that going to work? All this care that we've been getting in the hospital, who's going to cover that? And so it's many people think that Medicare, you qualify for Medicare when you're over the age of 65. Surely they're going to pick up for that because it's way more expensive to have her in the hospital than to stay at home, right? And certainly less expensive than having her in a nursing home. But we find out Medicare doesn't actually cover it. So in very limited cases, they might pick up the tab for a couple of days, but really not much more beyond that. So that's where this whole world that we call home care comes in, right? There are folks who can come to the house and do a little assessment and say, okay, you need help with a little bit of bathing, you need help with dressing, you need help with catheters or prescription drugs or things like that. And they provide the day-to-day assistance around the house that allows people to live with their families and in their communities. And so every expert, and I think this would be a point of common ground, which is why I want to start here. I think every expert would say that it makes much more sense to invest in this form of care up front, the kind of care that allows people to be with their loved ones It is by far the least expensive form of care. It saves a lot of money later on in the system. And that our system right now should be rebalanced so that we're emphasizing that kind of care as opposed to just letting people go until they have to come back to the hospital again or institutionalize a facility like a nursing home where things are much, much more expensive. In Maine, it's about $50,000 a year for full-time home care, and it's about $100,000 a year for nursing home care. So obviously, for most families, that's more than they're making in an entire year, certainly on even just the home care side. The nursing home side is much more expensive. So the question is, okay, so what do you do if those costs are really beyond your means? So if you are low income, you can actually qualify for Medicaid, right? So in Maine, that's Maine Care. And so that's, if your household income is really, really quite low, like if, just as an individual, $14,000 a year or less. So you've got to be pretty poor to qualify for Medicaid. And there's a whole lot of people who really don't have $100,000 sitting around in their bank account to shell out for that kind of care. But they're also not so poor that they're actually proud of, working their whole life and paying off their mortgage and being able to provide a little bit for their retirement. And so they're in this really tough choice, right? And so a friend of mine in Lewiston named Ray, it was in that exact same position. And so he was a working class guy. He actually did a decent amount of time in the mills growing up, and he, at the end of his days now, had to give away, spend out all of his money, every single penny that he earned, every asset that he had accumulated, in order to be poor enough to qualify for Medicaid. So he now has nothing to pass on for his children. And that was just the decision that he had to make in order to get the services that he needed to live and survive and have some portion of dignity. So I think that's another point of agreement that we can all start off with. Like, that doesn't work. That doesn't make sense. We should not, as a society, be incentivizing poverty, right? So the point of this universal home care system is that nobody should be in that position. That if you're over the age of 65, if you have a disability, you should be able to receive some set of baseline services that allow you to live at home and have that life of dignity that people deserve. We should say, too, on the disability side of things, people are probably pretty familiar with the Section 21 wait list. So there's people with disabilities who could be actually with their families, but they're not able to access these services because there's a long wait list for them. We should also say there's an economic side to this as well. I was talking to a small business owner in York County the other day who is really dreaming about redeveloping some mill space. And she has a mother who is in her 80s, and the early stages of dementia are starting to set in, and she needs more and more attention, more and more care. And so she right now is having to choose between, am I going to redevelop a mill, right, which is going to take a lot of time and energy and money, or do I actually need to scale all that back so that I can stay at home with my mother? Because that's one other option too. You see people actually putting their whole careers on hold in order to provide the family care that folks need. So this current situation is actually bad for our economy as well. For the people who are involved in the system, if you're a home care agency, the biggest payer right now, because so few families can actually pay out of pocket, the biggest payer for these services is Medicaid. And they reimburse providers at a rate so low that workers cannot make much more than the minimum wage. And now just thinking back to the kind of care my grandma was needing, I mean, it is the most intimate form of care that a person needs. And it requires a lot of physical skills. You're moving human bodies, right? Like sometimes 100, 150, 200-pound people need to be moved around. It's hard physical work. And of course, it's hard emotional work as well. It's 100% people skills. Not only the folks that you're working with directly that you're caring for, but all their family who are also in the picture too, who of course are really concerned about what's going on. So it's a very demanding job, and it's just too hard to hire people at $9 an hour to pay for this when they could be getting $9 an hour doing far, far easier work. So as a result, there's a real shortage of people who are able to take these jobs and perform this work. So another thing this referendum would do is provide more resources for the current system and the people who need it to make sure that workers can actually make more, which would be good for the agencies providing the care so they can hire more folks, be good for the workers themselves. Another worker I was talking to the other day is actually working full-time on all this stuff, but is raising a son as well, and is actually having to stay in an abusive relationship because she cannot afford on this wage to go out and pay her rent by herself. Like, she has to split these bills with her husband because that's the reality of what life is like on $9 or $10 an hour.
About 2 more minutes.
Okay,
Thank
great.
you.
So, to wrap up, I'd say Maine's right now going in the wrong direction. If you compare now to 8 years ago, there's actually a high percentage of people who are seniors who are in nursing homes that are getting home care. We're one of only 2 states that have taken that direction in the last 8 years. Every other state in the country is going the other direction, where they're rebalancing more towards home care. So we can't let this continue. And of course, the bottom line is, how do we pay for it? And I'd imagine tonight we're going to talk a lot about this. But for us, the very common sense way to figure out how to pay for it is to say, okay, why do not our existing social insurance programs like Medicare and Social Security actually cover this? There's an arbitrary cutoff at $128,400 where people stop paying the payroll taxes on income above that. And if we were able to close that loophole, just partially, as we do in this referendum, we have the ability to raise the funds necessary to provide this coverage for folks. We should say that in Maine, the top 1% actually have a lower state and local effective tax rate than any other income group in the state. So if you add up all the property taxes, sales taxes, income taxes, excise taxes, the top 1% actually pay less in their income and taxes than does every other income group in the state. We've given over $50,000 of tax breaks to the top 1% in the last 6 years at a state and federal level. This doesn't even get us halfway back towards recapturing that. But I think it is possible, if we make our tax system a little bit more fair, closing these common sense loopholes, to be able to build out the public infrastructure that we need to make sure that seniors and people with disabilities have the care they need. So that's what we would encourage everyone to vote yes on one.
Well, you did it within 10 seconds.
I've tried, yeah, okay, all right. And thanks for keeping time.
Okay.
I just want to say thank you to the library for having us. Nancy, I'd be remiss if I didn't say it. My mother was a school librarian growing up, so I just want to, these community events are great. Thanks for having us. And just want to start a little bit about, you heard Percy, I said I have 4 kids and I have 2 80-year-old parents that live in my household. I want to talk a little bit about how this impacts our family, but also why we're opposed to it as a family, and then talk about the coalition that I'm here to represent. I have 4 kids I mentioned earlier. 3 of them are adopted, 2 of them came out of the foster care system. We deal with a disability issue with one of my children in my house. We also have 2 80-year-old parents that reside with us. They happen to be my parents. One of them is a school librarian. My dad does receive home care assistance. He served his country. We do some help through TOGAS and through some other avenues. He broke his hip this summer. He had a hip replacement that broke his leg, and he has to get around by using a walker. So I don't come to this lightly, to this decision that this is a bad idea for the state of Maine in terms of this referendum. Because personally, we have a lot of stake in my household over the outcome of this issue. But my family's opposed to it, and you're gonna find out a lot of other people are opposed to it because it's bad for our economy. It's bad for our home care industry, and it's just plain old bad government. And let's unpack that a little bit and talk a little bit about why is it bad for our country, for our economy. You heard Ben say we're just gonna tax that income above $128,000. But what we're gonna do is we're gonna make Maine the highest tax state income tax rate in the country. Well, we say that in bits and pieces, and we decide these campaigns in 30-second sound bites, but what does that mean? That means we currently have a 7.15 tax rate here in the state of Maine on income. We will have a tax rate of 10.95% if this passes. On, not individuals, on family income. And don't take that from me. Read the question for yourself. Please read the bill. There's 11 pages behind this. This 3.8 tax, this is from Democrat Secretary of State Matt Dunlap, a new 3.8% tax on individuals and families. That is combined household income. That's over 60,000 families here in the state of Maine that will now have a tax rate of 10.95%. That is a teacher here in Scarborough making $60,000 a year, and they may have a husband that's a welder down in Portsmouth making $80,000. They're gonna get hit with this tax. We're gonna talk a little bit about the home care piece, but that money's gonna be used to fund a home care system that doesn't have any means testing, that allows millionaires. You don't even have to be a resident of Maine. You can be a summer resident to qualify for these services, and we talked a little bit about that. So we're gonna have the highest tax rate in the country for Maine families, over 60,000, that's 120,000 individuals, it's family income. You add their kids to that, You're talking the impact of this tax rate to well over 150,000 people here in the state of Maine. That's not the 1%. What does it mean for businesses here in the state of Maine? Businesses in the state of Maine are formed by partnerships, LLCs, S corporations. They're small family businesses, that's how they form, they're an S corporation. They get taxed as a pass-through entity on their income. And these are the businesses that sponsor your Little League teams, they donate to the community. These are the backbone of our community. They are now gonna have a tax rate of 10.95% on all gross income above 128,000. That's the highest tax rate, but what's really not fair, and I don't understand why someone would write a tax law like this, is their effective tax rate is 10.95. The corporate rate is 8.93. So Walmart is gonna have a tax rate of 8.93 if this passes. And the mom and pop store that sponsors the Little League and all that is gonna have a tax rate of 10.95%. That's not fair. In our tax code, we've written it to give an advantage to those that operate in Maine. Now we're gonna give that advantage to the corporations, to the big box stores, to whoever it may be if they're incorporated out of state, they're a Maine-based business. This is gonna devastate our economy. The Department of Financial Services did a study that said, over the next 5 years, $2 billion in income. If you're mobile, you will leave the state. We will see young people flee, 10.95%. Massachusetts is less than half that, 5.1. We all know what New Hampshire is, it's 0. Florida is 0. You're gonna have a lot more folks move to Florida 6 months in a day. 11% is a very, very high tax rate on income, combined family income. If you have kids and you're trying to save for college, you're trying to save for your retirement, 128, you're doing okay, but you still got a lot of stuff to pay for at that point. Now, it's bad for our economy, and I think, it's gonna hurt us severely in terms of money leaving the state. It's also bad for home care. So I represent the Maine State Chamber of Commerce. There's over 30 business associations statewide oppose this, but on the home care piece, the people that are opposed to it are the doctors in the state, the Maine Medical Association, the Maine Hospital Association, the Maine Home Care and Hospice Alliance of Maine. The folks that administer this care are opposed to it. We just brought on board the Maine Association of Community Service Providers are also opposed to it. Those are the people that take care of the disabled here in the state of Maine. Why would those groups, all part of the long-term care continuum here in the state of Maine, oppose this? Because it's so flawed and so poorly written. The number one reason, I mentioned it earlier, we're gonna take all those tax dollars, $310 million, and we're gonna pay for home care services without means testing. That means anyone qualifies. A millionaire will qualify. There is no residency requirement. The bill, and I encourage you to read the bill, says living in Maine. So you can be a summer resident who won't pay the tax if you're not a Maine resident. And you're gonna have services paid for by the hardworking families here in the state of Maine. It's also, if you don't have a means testing, the amount of people that are qualified, that truly need it, and I consider my dad might get there someday, is gonna have to sit on a waiting list, which the law contemplates and already puts into place. Because you're not gonna go to the most needy first, it's anyone that qualifies. You're gonna have people with unlimited income. Now, God bless the people who live on Proud's Neck, and that's great that they live there, but they probably can afford home care services for themselves. But those that truly need it are gonna be on a wait list. Now, another issue in terms of how this is written, and this one, I think, the patient-provider relationship is a very sacred one between home care workers, home care industries, doctors, and their patients. This law clearly, without question, violates that privacy. It violates HIPAA. It allows them to distribute, and we're gonna talk about bad government because it sets up a 9-member board outside of state government with no accountability. It allows them to share their private medical information and the services they're receiving to constituency organizations. It's not even defined in the law, but those groups that they're gonna define as constituency organizations. So someone like my dad, they're gonna receive his contact information, the services that he's receiving, automatically if this passes. It clearly violates HIPAA. We have all the healthcare attorneys here in the state of Maine that look at that and say it violates federal law in terms of HIPAA, because now the other side may say that you can opt out of it, but that's like Facebooking my dad. He's already opted in automatically if this passes, and he has to opt out. That HIPAA doesn't work like that. HIPAA, if you go to your doctor, You literally have to sign a piece of paper. They have to come to you to allow you to release your private medical information. If you call my doctor today and says, Ben Gilman, a patient of yours, they say, no, he is not. They can't relieve, they cannot give that information out. This law, if passed, will allow that private medical information to constituency organizations. Now, I already mentioned earlier, and it's bad government. It's a separate board outside of state government that's gonna collect this tax. 9-member board that's gonna be elected from folks outside state government with no accountability, no oversight from the legislature, no oversight from the executive branch. It's gonna be established, and they're gonna have the power to control this $310 million. Not only will it be ripe for fraud, possibly, in terms of being outside without accountability, without, the checks and balances that we have in our state government, but they're also gonna be allowed to have the private medical information of those that are receiving services. So, from that continuum of our long-term care community, looks at this and says, geez, what's going on here? This is just, if you were gonna write a home care law and improve our home care system, which we probably need to do in the state, this is not how you would do it. If you went to anyone in the home care field, in the medical field around the country, and you were gonna design a law, you would not set it up outside government, you would not set it up with no means testing, you would obviously require a residency requirement, and also the pay for it. We're gonna destroy our economy in terms of, so on the other end of it, I have 4 kids that I want to be very successful. I want them to make that $128,000 a year. And if they do, they're probably gonna leave the state of Maine. Because we know that that income is gonna leave $2 billion. $2 billion. So one last point I'd like to make. Why are we dealing with this? Why is it on the ballot? I mean, we were, last session in the legislature, advocating, the Maine State Chamber of Commerce and Business Committee, for more pay for home care workers. We have a group from out of state, $350,000 of money that came here to put it on the ballot. Similar to just last year, we had a casino show up. We're gonna decide a very important issue, our tax policy and our home care policy, with 30-second sound bites on the television that impacts every single person here in the state of Maine, because it's funded by an out-of-state interest. Just like we're gonna have someone come in and get a casino license, a shady billionaire, and put it on the ballot that only he could benefit. I believe the people of Maine will see through it. And I just wanna close with, don't take it from me, all 4 of our gubernatorial candidates oppose this. You have Democratic Attorney General Janet Mills, who's come out and said, really bad government, outside state government. You have Terry Hayes, independent treasurer, who was a former Democratic leader in the House, she opposes it. Alan Caron, another independent, he worked in a King administration, he opposes it. And the Republican Sean Moody, the small businessman, he opposes it. Because they have looked at it, anyone that looks at it, the groups we represent, over 40 of them, from the healthcare to the business field, all across the state. If you read and look at this, it really is what it is, it's pig and a poke. So, I'm sure we'll discuss it a little bit more here, over the course of the evening, but it will devastate Maine's economy, it will hurt our home care industry, violate people like my dad's privacy, and go for services for those that aren't even residents. And it's gonna set up a whole shadow government that's out of control. So, thank you.
And we've already handed out some note cards. If you'd like to write questions on that specifically, but you can do it during this juncture when the 2 respondents literally respond to each other's comments. I found it interesting that Ben Chin talked a lot about what it means in terms of service delivery and the well-being of clients. But Gilman, and I'm not trying to make, you're much more concerned with the financial side. I think both of those dynamics come into play here. And so that might be a way to start about a 5-minute discussion on how you see the other position being laid out. And I think it's probably important to talk about how you might bring them together, because you don't have legislation that's implemented regardless of it being initiative or otherwise, unless you deal with financial concerns. So Ben, why don't you begin? 5 minutes for each of you.
Sure.
Or you can interrupt each other.
No, I think the less interruption the better. But, yeah, thanks for laying that out, Ben. So just to respond to a bunch of that, I would say, really gotta pick. Either we're upset that millionaires are paying the tax, or we're upset that millionaires are eligible. But it doesn't make sense to be upset by both. We absolutely are in agreement that if you are really wealthy, you should be contributing something to the system. So that's why we have taxes. Like, that's why we have an income tax.
I just, 128,000 isn't a millionaire, no matter how you define it. A family income of 60 and 80,000.
Sorry,
is
Ben.
not
Are we going to do the interruption?
We're not, but you can't say that it's millionaires when it's not.
Well, I don't know if we can settle the issue here of what is a millionaire or not, so why don't you keep going?
Yeah, no, sorry, Ben, I was just trying to borrow your language there. So,
All right.
I think you're the one that brought that up, and so, on that point too, the only nonpartisan office of the state that has looked at this, who, Ben knows from being in the State House, is the Office of Fiscal and Program Review. They're like Maine's CBO, right? And they say very clearly on the fiscal note that this is a tax on individual income over $128,400. The reason why the word family was added into the question was because that other sources of income besides wages that a family can earn would also count towards that threshold. So that's the only nonpartisan entity that's looked at that. All the other stats, from the study that Ben was talking about to the analysis where the threshold hits, all the sources on those go back to the governor and his political appointees, who have a legitimate ideological difference that I will acknowledge right up front about tax policy and the economy, right? And there's like two ways to think about how to grow the economy. One way is the more and more we do for people at the top, the better off everybody else will be. I think we've been trying that for a really long time. And I think what we've seen is the more and more we do for people at the top, the better off the people at the top are. There's another theory that says the more we do to build a broad base in our state so that everyday folks who are workers, who are parents, who are family members can meet their basic needs and have a little time and resource to invest in growing the economy, that is actually a much better, stronger, bottom-up, more robust, safe way to build the economy. So all the differences that you're going to hear tonight between us on taxes, I think really just kind of boil down to that fundamental difference between how we see that. I'm not going to try to change Ben's mind on that, and I don't think he's going to change mine on that either. But I think it's good to acknowledge that right up front. And that's why, by the way, we have a set of small businesses that also support this, the Maine Small Business Coalition. We have agencies like Holding Hands, Ocean Home Health, Gateway Community Services, Community Home Health Care, Global Home Health. All these are agencies right now that are actually funded, unlike hospitals and unlike doctors, they're not mostly funded by the current system that isn't working, that's balanced towards that expensive acute care. These are folks who are really much more trying to make do on these lower Medicaid reimbursement levels who are supportive of this.
Let me just ask Ben a question here.
Sure.
Is there a way, well, if this goes to the legislature, there will have to be some form of reconciliation. Is there a possibility in your mind or options that ought to be looked at?
In terms of if it goes to the legislature after,
Yeah.
I don't believe it's gonna pass, so I don't believe the legislature's gonna have an opportunity, but I do wanna respond with, and we are gonna disagree with this, but the 3.8% tax is on individuals and families. It's not individuals. OFPR put that out before there was a public hearing on this bill. Had there been a public hearing, that information would have been teased out in terms of what is individual and what is family, but the Maine People's Alliance didn't wanna have that. So they killed a public hearing and airing. Why didn't we wanna speak about this in public last spring, find out the details? What has happened since then, as I said, that was not in here, individuals and families, it was just individuals. But Matt Dunlap, Secretary of State, upon guidance, he doesn't make these changes, across the board. From the Attorney General's office and Maine Revenue Services, they made that determination. Read the question for yourselves, it's not me. He wants to point this as Paul LePage, but it's not. The change within the question came from the Secretary of State's office. It is combined household income. It is gonna impact over 60,000 families here in the state of Maine. And it's not millions, and it's not millionaires. Okay, in Maine, in terms of millionaires, that's a couple hundred people. These 60,000 families are not millionaires. They are making, they're the $128,000 to $200,000 range combined income. That's what we want. We want success here in the state. And that's where that information comes from. Like I said, don't believe me, read the question for yourselves, make your own determination. And also, look at the, why did they make that change? Why did the Secretary of State make it from individuals and families, household income? So.
Yeah, so Ben, I guess I'd say, so if you're in agreement that this tax shouldn't be on households, should be on the individual income level, like, we're in agreement there too, and I'll just say here right now, that there would be, if there's any legislation the chamber wants to put in next year to clarify that, if there's some wording that you'd like to tweak in that bill, like, let's do it. Like, you have my pledge right now. We can do that. We can make this happen. What I was kind of waiting for you to do as you wrapped around towards the end there, what I think you were trying to get at, Bruce, is like, oh, is there a way to find some way to come together in legislature to deal with this? Is we actually are not in a position as a state any longer that we can just sit around and wait and not have a comprehensive solution to this problem. My interest in sort of what Bruce is pushing you on a little bit is saying, okay, what are the ideas that we're going to bring to the table to solve this otherwise? I mean, I don't think I heard you disagree with any of the facts that I laid out at the beginning about the magnitude of the challenge that we face, about the fact that the care isn't affordable, about the fact that we need to make it affordable for families. And I think it's great. We were right there with you advocating for reimbursement rate increases in the last session.
Where were you?
We absolutely were.
You didn't testify.
Ben, if you're going to interrupt me tonight, I think there's going to be a little bit of an unpleasant evening.
No, I'll take care of that.
Okay, all right.
That's what I need to do.
I appreciate it. And so I guess I would just kind of lay that out there, is there are certain reasons why we think that everybody needs to have some sort of coverage. And it'd be one thing to come forward and say, you know what, there's this alternative path that we can take. But to talk about the board, for example, and we should talk much more about this. You realize a lot of stuff around the board. And I'd say it's really fascinating to me that, there's two ways you can kind of set standards and provide something for an industry. One is, the government does nothing, right? And that's basically where most people in Maine are at. Like there's zero, nothing's happening. The other is the government just says by edict, okay, here's what the reimbursement rate is, here is who is covered, here's every little detail of the program, and micromanages the whole thing. And I actually think many conservatives have a legitimate critique of that form of governance, that a program that needs to be tailored and designed and flexible to meet the needs of families, I think shouldn't just be designed on autopilot in law. And so yes, we have created what I think is going to be the most accountable system that we have on the books in Maine. It will be passed by the voters, right? So the whole basic outline, structure, funding mechanism, eligibility standard, passed by voters in referendum. And then the details that we're talking about are going to be designed by the stakeholders of that system. So the families who use it, the workers who are doing the day-to-day work, and the agencies that are on the front line providing the care will all be on this board representing their interests to make sure that it's designed and functions well. As for the privacy concerns, you can look at the bill yourself. There's 4 different confidentiality sections.
So let's talk about that. Let's talk about the accountable board.
That board, because it is the way this thing's going to be implemented.
Let's talk about this unaccountable board that isn't going to have oversight from the legislature, and it's going to be completely outside state government, which is actually unconstitutional. Former Chief Justice Dan Wathen has written about this. And you cannot set something up that's going to control taxpayer dollars outside state government because there's no oversight. There's no checks and balances. But let's talk about part of the reasoning behind this and why an out-of-state billionaire, along with some out-of-state unions, are funding this. Part of this unaccountable board and a lot of this language in this, read the bill for yourself, 11 pages behind this. The reasoning why it is that the home care workers here in the state of Maine, if this passes, will become Maine state employees for the purposes of collective bargaining. They will be forced into a union. The problem with that, though, is they won't receive any of the benefits. I was a card-carrying member of the Nissen Bakery Union up on Munjoy Hill when I was put myself through college, and I packed Brett along, Paul Brennan, Joe Brennan's brother, up there for a few years, and they were members of that union for the pension, for the days off. They're going to force these folks into the Maine State Employees Union without the benefits. They're going to have to pay the fee to be a member of the union, and that's why you have $100,000 from SEIU coming in to support this campaign. That is the type of thing that is gonna go on with this board, since it's set up outside state government. It's unaccountable to anyone. And it's also gonna have access, and Ben brought it up, to private health medical information. And they're gonna use that for campaign and electioneering onto this board. And that's why you're gonna get that information of what is their, what services are they receiving, and their name and address and contact information. So if you're being represented by by the SEIU, and Vinny can come to your door and say, hey, Mrs. Gilman, I want your vote for the election to the board. That violates their privacy in terms of releasing that information that they're receiving services. It violates HIPAA. So this thing has so many issues, and I want to push back on one thing. Someone said, oh, we already know that, that we have a problem here in the home care industry and that this is the solution. This is far from the solution. Everyone involved in the home care industry, if you look at them, they're opposed to it. You talk to any home care expert, and you say, if you gave them this law and said, would this be the piece of legislation to fix home care in the state of Maine, to increase wages to home care workers? No. And in terms of home care worker wages, there is nothing in this legislation, nothing that guarantees them a raise. In fact, if we're gonna put, all of a sudden, overwhelm the rolls with more people, create wait lists on this, where are we gonna, we need to find more home care workers. It's just gonna be a log rolling downhill.
Well, we need to move on, but I would like you to respond to that. And in fact, one question I would ask you.
Sure.
There are a lot of what are called public authorities, and this would be amount to a public authority, which are designed to be largely independent of the day-to-day operations of politics. And there are good reasons why. And to a very large extent, as I understand it, that characterizes the Maine Turnpike Authority, that it's largely a technical enterprise. So, and you sort of.
That's very different. That's the Maine Turnpike Authority. It's quasi-governmental, and it exists for the users that use the turnpike, and there's a user fee. And it's like the other side comparing this new board to the Maine Potato Board, which is a trade representative board that uses $1 million that potato farmers agreed to a tax on the potatoes to promote eating Maine potatoes all over the country. But this is all the people in the state of Maine. It's all taxpayers. That's why we have government for the oversight. When it involves everyone here in the state of Maine in terms of the taxpayers here, it has that government oversight. And the board actually is placed in the government, not the trade representative board, but in a different section of the law.
Hold on just a second. Let Ben respond, and then we'll get to the question.
Yeah, thanks. So there's a lot in there. Just to really quickly say, these arguments around forced unionization and constitutionality they're just silly. So for all the reasons.
Chief Justice Wathen's silly.
Okay, Ben.
I couldn't.
Hey Ben, can you just give me a couple minutes?
Yeah. His
hey
memo.
Ben, like I'm really asking you.
Okay.
I'm like really like looking you in the eye, being like,
Please
could you just let me speak
Please
for a
don't
few minutes?
insult the former Chief Justice, that's all I'm saying.
Yeah, I did give him the floor, so go ahead.
Yeah, I'd like to have equal time.
Yeah.
So the constitutionality argument is really simple. The legislature at any point, just like the Turnpike Authority, Maine State Housing Authority, Finance Authority of Maine, could change those programs any way they want. They could repeal them. They could change how they work in any fundamental. There's no power taken away from the legislature. That's totally constitutional. Supreme Court, many federal laws are very clear that no home care workers can ever be asked to join a union against their will. There's nothing in this policy that contradicts that. Those two are pretty easy. The privacy thing is pretty easy too. There's 4 separate confidentiality protections that are written in the bill. Judith Lichtman, there's more information on the Frequently Asked Questions website if you want more information on this, but she actually helped draft the HIPAA privacy law at the federal level. She's reviewed it. She's very clear, like this is absolutely not a violation of HIPAA. And the opt-out list that Ben's referring to is for people who want to receive information about the board elections and participate in that process. Not only is there no medical information ever exchanged, but even if you don't want to participate in the board elections, we're saying there's an opt-out to participate in that. So I think the key question that we're getting at earlier is, why is this on the ballot? And we talked a little bit too about some of the money things. I just got to say, this is pretty rich. I'm pretty proud. We're a grassroots organization, 32,000 members. There's over 4,000 people who who have made small dollar contributions to get this campaign off the ground. And all that has been disclosed to the Ethics Commission. And 48 hours after the last filing, the No on One campaign bought $800,000 worth of media, which I would love, Ben, if you're interested in sharing with us, who is funding that $800,000 media buy? Because that actually wasn't disclosed to the Ethics Commission.
Okay, this is the last question, because I have a pile of cards here, okay, so respond to that.
So, our campaign is 100% funded by in-state contributions from Maine businesses, Maine people that are very concerned with this taxation. 95% of the dollars funding the Yes campaign come from out of state. They come from an organization funded by George Soros. It's very similar to dealing with the casino referendum we dealt last year. Someone trying to put a policy on the state, on the Maine ballot as an experiment to run it in other states. You know, these shady billionaires showing up because Maine's an inexpensive state to run campaigns compared to New York and California. So to say all our contributions, and yes, we are running a campaign, we are concerned, and we are trying to raise dollars in order to run advertisement and to get the word out there in terms of this. 95% of their dollars come from out-of-state people that, why are they concerned here with the state of Maine? We'll talk a little bit more, but remember, this is gonna be a 10.95% tax rate on Maine businesses. Out-of-state corporations will have an 8.93 rate.
So, but sorry, Ben, just so I'm good. Who gave the 800,000?
What?
Who gave the 800,000? Who are the donors that weren't on your first report that gave the 800,000?
We are raising money from Maine-based businesses here in the state, Maine individuals, and just.
But do you want to decline to disclose that to folks right now, where that money came from?
Where our money in terms of, they're the businesses that sponsor your soccer team, they are the businesses that support your community, they are the Maine State Chamber of Commerce, we have the Realtors Association. Okay, I'll name some of the groups. We have the Hospital Association, NFIB Maine, Retail Association, Innkeepers Association, Restaurant Association, Grocers and Food.
Okay, you've got 37 of them.
Yeah, so,
Okay.
and the healthcare industry as well.
Okay, why don't, I think a lot of the issues where we are right now have been addressed in questions, so I'd like to read questions and have both of you address them. They vary quite dramatically. They deal with the delivery of services. Specifically, they also deal with the question of the referendum process and how that plays out when it gets to the legislature, and they deal with the issue that Ben was dealing with, costs. So why don't we move through these to the best that I can sort them in this short period of time. So why don't I read them, because they move in conjunction with issues you're raising, but also broader issues at the same time. Here's one that says, several recent referendums have been passed by the citizens and ignored, I assume by the legislature. What are the chances of this being vetoed or unfunded if all gubernatorial candidates are opposed? That was an issue that in fact you raised. And it goes on to say, the bill says it can't be designed and delivered if there's no funds are available. But let's deal with the first point, which is there is a certain history to initiative measures in Maine. And to what extent might this, who knows, if it is vetoed or unfunded? What is your sense? And I think it's a sense at this point in time of both of you on that issue.
Yeah, so I'd say this is a very fair question, and this is why, incidentally, the constitutionality stuff isn't an issue, right? Because we all know there's no shortcut. The legislature really could repeal it. So the only way to make sure that doesn't happen is to make sure that we elect people in Augusta who are going to respect the will of the voters. This is the first election that we've had since the legislature monkeyed around with 4 of the major referenda that passed. And so our hope is that we can elect people who actually do represent that. I take it as a fair point about the gubernatorial candidates. And you know, I think Janet Mills is the one that sort of sticks out for folks. And just to speak very directly about that, this messing with the will of voters thing, it's not a Democrat or Republican thing. You know, both parties have been guilty of it. And there, I think, is a reaction just as much among Democrats as Republicans that politicians in Augusta want to micromanage and control things. And I think what we're seeing right now is a split. between people who are interested in respecting the will of the voters and people who really want to curtail the referendum process wholesale. So we can't control the fact that that's where some politicians actually like to be. But I will say the lesson I learned from the past referenda experiences, whether it was around education funding or minimum wage or ranked choice voting, is that even if the voters don't get exactly what they want, it is absolutely true that in terms of building political momentum to find a real solution to an issue, having a majority of Mainers show up on election day and vote yes on question 1 to pass universal home care will make it much more possible for these kind of services to exist, because people in the state house, they're politicians, they know how to read the way the wind is blowing, and there's only so much that they're willing to do to go against the will of the voters. This will, no matter who is in there, it will greatly increase the possibility that we can actually get something done right now. And that's kind of the main message I want to take away, is that for anybody who has an aging relative, this is an issue right now. And when you get that call from the hospital saying, we have maybe 9 months left to go, you do not have time to go out and work another 6 jobs for another 10 years to save up that money. This is a thing that families right now need urgent care about. That's why we have to take action now.
Ben, this question about vetoed or unfunded, as well as another question that I just received regarding if a former Chief Justice's opinion on constitutionality, or how does it override the process of judicial review? Well, I can answer that one. It doesn't.
It doesn't, but it gives people some guidance. You have someone that has some experience with this, that looked at it, and made a determination that if he was still there and he thought it was fairly black and white, that having this board set up without the accountability outside state government had severe constitutional concerns. Now, what Ben said earlier, we're passing a statute here, and that's what all referendums here in the state of Maine are, their statutes. And in fact, I think since 1968, since the ones that have been passed, over 78% of them have been changed in one form or another. This one is so severely flawed. If it did happen to pass, and we hope it does, the legislature is going to have no choice but to make substantial changes to this based on things like that. We can't have unconstitutional laws here in the state of Maine. But it's too bad that we do it before, why couldn't this be determined before, that it's whether it's constitutional or not, before it even ends up on the ballot? We're governing by citizens' initiative here in the state of Maine, and no offense, but I don't want to become California and be voting on Prop 68. We need to change our cities.
We're 3,000 miles from Maine.
We don't need to govern through the citizens' initiative process here in the state of Maine. It has got out of control. It was put into place in 1910 for a reason, to let people address some concerns. But now all it's being used for, if you look at all the recent referendums, they're funded by groups from out of state coming into Maine to kind of push their agenda nationally here on the state. And that's why, if you look at the groups that oppose question 1, that make up our coalition, they're all Maine-based, whether it be from the healthcare field, from the business community, because if you go and read the legislation for yourself, it is severely flawed, and it would be bad for Maine. It would be bad for our economy. It would be bad for the home care folks and those that receive the services, and creating more wait lists. It would be bad government.
Let's move on to money, which obviously is an important concern about this initiative. Several different questions that approach the funding issue differently. The first one, if we add 3.8% to our taxes for this one thing, how can we raise money for infrastructure, education, and other healthcare issues? Obviously, this is fundamental to how money is spent in general. I started with you last time, or I started with you.
I think this is a fundamental question. We're going to take all our eggs and put them in one basket. If you look at the long-term care continuum, if you're looking at 4 wheels on a car, okay, we're going to take $310 million. We're going to max out our income tax rate at 10.95, put it into that. What about nursing home care? What about whether it be doctors, the Medicaid reimbursement rates, all that stuff? We're taking our tax, all $310 million, well, 40% of our income tax rate, and putting it into the home care industry. What happens when we need more money for education? What happens when we need more infrastructure here in the state of Maine? We'll be the highest in the nation. We have maxed out our income tax and put all our eggs into one basket. I think that's why you see the Disability Association. They're concerned, the Maine Association of Community Service Providers. that there won't be money down the road for some of the services they need because we put all our money into home care. And it's very important. We advocate, we need to pay home care workers more, and we need to do better, and we need to create a vocation with home care workers. LD 924 from last session, we were supportive of. And we need to do, we need to have a plan for the state of Maine. This isn't the plan, and this is taking our tax dollars and making it just in one basket. And it is statute, the legislature can change it, but for that period, what happens if we need to, shift revenue someplace else? This statute won't allow that.
Ben, I'd like to just ask you, I'm not sure when I read this that the significance of a 3.8% increase relative to other expenditures. So if you could shed any light on that, respond to that.
Yeah, sure. I mean, I think just to put this in the biggest picture context, it was about $800 million of tax breaks that primarily benefited the wealthy that have been passed in Maine over the last 6 years. So from my perspective, in terms of what it's going to take to actually rebuild our state's infrastructure and make sure that education is fully funded, this is not even getting us back to baseline, to where we are. And I think we've all seen that. There's been a tremendous shift towards property taxes. I don't know much about the town of Scarborough's individual financing, but my guess is that you've had some pressure on property taxes, that as the state's share of revenue sharing has declined, my guess is the town has come to you and said, oh, we've got a growing population, and guess what? Schools cost money, so the money's got to come from somewhere if it's not coming from Augusta. That's the same story all over the state. I also think, why we talked in the beginning about why home care is so smart. It's foolish to be penny wise and pound foolish when it comes to this. These are the investments that actually save us money in the long run. About 5% of Maine's Medicaid population accounts for about 55% of the whole Medicaid budget. And it's primarily elderly folks. It's primarily people who are needing to use lots of acute care in the most expensive settings possible. So I think the numbers on this are all on our side, because in addition to not even getting us back to where we probably should be in terms of where our tax code would be fair, this is actually going to free up resources by making sure that our money is much better spent when it needs to be spent, where it needs to go.
Just real quick response. So we have adjusted our tax rates here in the state of Maine over the last few years, but compared to 4 years ago, Maine has paid $600 million in more taxes this year than we did 4 years ago. Our taxes have gone up, tax rates have been adjusted, but in terms of what the state is collecting in taxes, tax revenues have gone up.
Just maybe I can understand that number, just to make sure I get
Okay,
it.
this will
Yeah,
be.
so we are paying as a state more in taxes than we were 4 years ago. Tax rates, we did adjust our rate from 8.5 to 7.15 over the last 8 years, our tax rate. But in terms of taxes, we also increased the sales tax. We've done some other adjustments. There's more revenue being collected in terms of taxes. They haven't received the tax cuts that you speak of. That 800 million?
But just to be clear, just so I understand what you're saying. Yeah. What I think you're saying is that the overall revenue has gone in the state mainly due to economic growth, right? The economy has grown a little bit, so tax revenues go up. I think that's what you're saying. And I guess all I'm saying is we could be capturing that even more fairly if we had a more progressive tax code. We could actually really be funding the things we need to do. I think that's the
Tax code more than double Massachusetts.
Here's a series of questions, which we really haven't dealt with to this specifically. First one is, would non-wage tax, interest, dividends, etc., apply to non-working or retired taxpayers on Social Security? For any of us who are over 65, that is a major concern. Ben?
Yeah, it applies to all income above 128,000. So whether you receive income from retirement, whether it be from, could be an alimony payment, you own a couple apartment buildings, you're saying any income above $128,000 a year is going to be taxed at that 10.95%. All income. So there is no exemptions in the way they wrote this, and they are the ones that wrote it. It is all income.
That's true, and just the explanation for that is, we think actually particularly seniors are going to have a much better deal here, because these are the folks that are going to be relying on the services. And the same reason that we talked about in the beginning, it's like if you are, making six-figure income as a retiree, yeah, we think it makes sense to chip in a little bit to provide for home care services. So that's the rationale behind it.
So, I just want to make one statement. So, we have and he's going to disagree, the DAFS report, the Department of Financial Services, which young people will leave the state. Young dual income earners will leave the state based on this tax rate. Couple thousand, $2 billion in income. We're gonna be the only state with these universal home care services without a means testing and without a residency requirement. Those folks will come here and we will use our young people. That's not a way to grow our economy or grow our state.
One other question that comes out of this, although it's somewhat different but from the same individual, does Maine's universal home care, how does it compare to other states, other models? When you do policy analysis of this type, you always look at other states. That's the comparative basis. What do we know about that? Would either of you like to comment on that?
This is first in the nation. There is no other model out there that looks like this. There was, I think Minnesota did a tax credit that they then had to repeal in terms of taking care of your home care workers in the state. And also, I just want to, if we look at this model, no one would set up a model in which I'm taking care of my parents and I qualify for home care services to give them those services. And we have programs here in the state of Maine that if you're taking care of a family member, you qualify. That is then going to make me, because I'm taking care of my mom and dad, a member of a union. There's no other program out there that would do that. So you wouldn't set up a program like this, and that's why no other state in the country has done this. This would be first in the nation, and I think if you look at the one model out there in terms of Minnesota, the tax credit they repeal.
A couple of our questions, by the way, deal with if something hasn't happened, it's difficult to establish a baseline. So that's given. This becomes the baseline. But the question of union, how do you view the point that was just made by Ben around that?
Yeah, so just to respond to both of those. So we would have the best home care system in the country, and I'm not going to make any apologies about that. I think that's a good thing. There are other states that are making progress. Hawaii, for example, on the family caregiver side, so sort of the more informal care, just passed a program that's universal in terms of that. I was just talking to somebody in Shelley Pinker's office who's really excited about the veterans program that's happening, so that just if you're a vet, there's a lot more work being done to set up systems like this for family caregivers to take care of people who serve our country, which is really important. So I think the point I make about what other states are doing is almost every other state is doing something and has been doing something for a while Maine's been going backwards. So this would be the best program, but we're making catch up. And I don't know how else to say the point about the unions is it just isn't in the bill. I mean,
So,
there's.
So can I read the bill?
Well, let him finish.
Yeah, I'd appreciate the opportunity. So, it's absolutely true that if you would like to collectively bargain, the workers in the system would have collective bargaining rights. And those include the people who are called independent providers. So those are folks who, the terms of their job are basically set by the Medicaid system, because that determines their reimbursement rate, which determines their wage, their working hours, what they can reimburse for, their travel, or all that other stuff. So all we're saying in the legislation is, if you would like to be in a union, you may then choose to be in a union, so that those workers don't have some loophole that they fall to, so don't have the collective bargaining rights as everybody else. There's not a single line in this that says you have to pay union dues if you don't want it.
So let me just read you the language from the statute, okay? For the purpose of the State Employee Labor Relations Act, that's for collective bargaining, individuals must be considered state employees. Must, not shall, not choice, must. That's been interpreted by some of the state's leading labor attorneys. That forces them to be state employees for the purposes of collective bargaining, and they're part-time employees, so they won't receive pension, they won't receive paid days off, they won't receive any of those benefits that my brother, who was a member of the union for 25 years, up at Nissen Bakery, packing bread, that he received. It's only therefore, and there is, this was written pre-Janus, before the Supreme Court decision about collecting fees, so there's a question of that, but that was put in there, and that's probably why the SEIU, the Service Employees Union, has sunk more than $100,000 into the yes side on this campaign. Must, read it for yourself, it's page 9, section 7291. It's not my language.
Response?
Yeah, I guess the only thing I'd say is that's not, so people can look at the State Employee Labor Relations Act, it's a state equivalent of the National Labor Relations Act, and that is not a collective bargaining agreement. That's a statute that says, here's what minimum wage is for state employees, here's how overtime is regulated. It's just the basic labor laws that Maine needs to have, that every other worker has. State employees aren't subject to the same labor laws as through the National Labor Relations Act. They're sort of carved out of that. And so this is just making sure Maine has at a state level what all their workers have at a national level. There's nothing in it that compels people to join a union in there. Nothing whatsoever. And I would just, we keep talking about the funding thing. I haven't had a chance to say anything about that. I mean, yeah, it's true. The Open Society Foundation, which supports healthcare causes, not just in America, but all over the world, is a funder of this. I mean, they're a serious organization. They support serious policy. I'm not ashamed of that. The Service Employees International Union, it's just a pool that millions and millions of workers across the country are voluntarily contributing their dues to support workers. And it's a working people's organization that I'm proud to be in solidarity with. So all of our money has come from people who really care about the system. And at the end of the day, I think people can judge it on its merits.
Thank you. Well, we have we have about 25 minutes. We have a few more questions. And then I'd like to open up to more general comments because a lot has been raised here. But I would like to raise these issues. Whenever you have a system put together like this, there are always concerns about what are called free riders. Given how, in fact, the legislation is put together, people may benefit from it from not paying their fair share. Dan, what's your sense that might happen in the other bend?
In terms of, yes, in terms of
Free riders, well, people who in fact have a certain income level, they can meet their needs, but at the same time, given how a piece of legislation is written.
I mean, I think that's one of the main concerns from some of those in the healthcare industry is that we're not going to serve the people that need to. Those that, at our income level here in the state of Maine that need these services, that can't afford to be put on a wait list. Right now, we do even have some of that. We need to increase funding for home care in the state of Maine. But as the example, there is no means testing in this law. That's one of the huge flaws here, is that there is no income requirement. You can be of any income level and you get the same access to the services even if you can afford them. And there's no residency requirement. So if that's what you're getting at, we need home care services for those that need it, those that can't afford it, and those are the decisions that the legislature makes. We have 3 programs here in the state of Maine, 2 beyond the main care programs, the Medicaid programs that help assist. We have the homemaker program that helps our elderly here in the state of Maine. We also have a program that goes above that, increases the income level for those folks here that's solely state funded. You don't see that in a lot of states. We take care of our, we do the best we can based on the budget we have to take care of our elderly. We cannot afford to fund, universal with no means testing. And those are the decisions that when you go in the legislature and they're making those decisions, the committee, that's why I think you're gonna see a lot of legislators, a lot of the gubernatorial candidates, they understand that in terms of our budgeting here at the state. We gotta take care of our most needy, but we can't take care of the millionaires. It's not affordable.
I guess I would just have people imagine, what if we means tested public education? So when you took your kid to kindergarten, they said, well, we need to see every asset that your family has and all your tax statements for the last 4 years, and then we're going to make an eligibility determination as to whether or not they qualify for free reading classes and maybe a discounted rate on your science class, and maybe we'll cover 50% of reading or recess.
Well, you could do if your son applies for your daughter for a scholarship. So, but that's a different issue.
Well, it is, but I think that's telling, right? Because it's interesting as a society what we choose to put in what bucket. There are some things that we say are so basic to just the fundamental responsibilities we owe to each other as Mainers, as a society, that we say, we're not going to means test roads, we're not going to means test public education, we're not going to means test Social Security, we're not going to means test Medicare, we're not going to means test, in this case, home care. Because if you are a senior citizen who needs help bathing, by definition, you are not capable of going out and working 2-3 jobs to pull yourself up by your bootstraps, right? You've reached the point in your life where all the work that you have done for your entire life to take care of yourself and those around you, I believe, has qualified you for some sort of basic assistance to make sure that you're not forced to sell off every penny that you've ever owned to, go bankrupt in your later days to just live a life with dignity. So I guess that's what I would say is, as a society, all the biggest public things that we do are not means tested because they're the most important things. And it's just a question, I think, of what bucket you want to put this in. Is care for elders and people with disabilities something that we want to essentially nickel and dime people for? Or do we think there's value in creating a broad-based public infrastructure to make sure everybody has access to it?
At this juncture, what I'd like to do is open it up to the audience so we can have some give and take. I'm sure we got volunteers. Yes and yes. Go ahead, sir.
I was just gonna make a comment to what Ben said. We do means test Medicare. Because if you make over a certain amount of money, you pay more for your Medicare than you do if you make less. I'm not sure what the threshold is, but people run into trouble when they sell an asset, like a house. It may go up, and then it takes you, I'm not sure how long, 2 or 3 years to get it back down to that level. So there is a precedent doing that.
Yeah, so can I speak that a little?
Sure, of course.
Yeah, so I think, Medicare's a complicated system, right? You got parts A, B, C, and D, and they all work really differently, And so I think that point's well made. I think what I mean in sort of broad strokes is there are absolutely, and Part D works this way too, where there are some fluctuations, little bits here and there based on income. But the fundamental criteria for Medicare is age 65, right? It's not like if you hit age 65 and you make some amount of money, you can't get any access to Medicare whatsoever, right? The point is, once you hit 65, you are going to access some suite of Medicare services. And you're absolutely right. The nuances and the details of how all that shakes out for everybody's individual benefits, there's some knobs and levers in there. But the fundamental thing that I think all of us agree is, if you're over the age of 65, you deserve health care, right? And so we're going to make sure that you get it somehow. And we're just saying home care should be a part of that. And I'd also say, too, that ever since 1965, I believe, when Medicare was passed, somebody can fact check me on that, long-term care, both nursing homes and in-home care, were envisaged to be a part of Medicare. That was a core. Long-term care has always been conceived as just like a part of the healthcare system that's weirdly left out. And so I think all the experts would agree that in the end, the solution that we're all hoping for is that Medicare would provide long-term care services, including home care for everybody. And that would, by definition, be one of these programs that was much more in the broad strokes a model of not means tested.
No, Medicare is means tested. They're dealing with my parents. I can also dealing with, I have children I already mentioned earlier that came out of the foster care system. There is a lot of means testing in the state law of how you qualify and what benefits you receive. It's all throughout our statutes here in the state of Maine and our federal statutes. Go look it up for yourselves. It is a fundamental difference. We believe there should be an income, a means testing within, with that. They do not. They believe that it should go, apply to everyone. So someone that's here just as a summer resident here in the state of Maine, that may be a millionaire, will qualify for the same services, and they may not even pay the tax because they're not a Maine resident. They're just living here in the summertime. They're going to qualify for those same services as someone like my dad who's been here his whole life and worked, and he may qualify based on the income on the means testing. So you're right, there is means testing all throughout the laws. It's not. So.
I'm sorry. I just had 2 questions, please. 2 quick questions. Ben, blue tie, Ben?
Yes. Ben Chin.
Red tie, blue tie. Anyway.
That actually reflects
What are you doing personally today to plan for your long-term health care?
Yeah. Do you want to get both out? And I can.
Okay. And the other one is, can you please tell me, in all of history, today, anywhere you want, where any society has ever taxed their highest earners into prosperity?
Ooh, I like that one. Okay. So first on my family budget, and then my view of all of human history.
one personal, one not.
One personal, one not. Yeah, exactly. I actually, my wife and I, we got a couple of kids in daycare right now. And so, as many of you probably know, childcare is about the same as in-state tuition at the University of Maine. So it's, they tell you to save up for college, and they don't tell you it's 4 years before you have a kid, you should really start saving up for childcare. And so we're looking at long-term care policies, and it's challenging to see how to make it work. so just to be totally transparent, I guess, about our finance, as instructive is, when we've talked to our financial advisor, we've been pretty clear. It's like, we're really trying to put as much into our IRA as we can, and that's just doing that is really challenging. And we've got a little bit of life insurance, right? And that seems like another immediate thing. Like if I were to die, I'd want to make sure that my wife wasn't saddled with our mortgage, basically. And so we're not quite there yet on the life insurance. But when we get there on the life insurance, then we want to think about the long-term care side of things, and we want to try to do that. But I guess, I'm doing all right. I've got all those things. Most people, I forget what the average amount of savings in an IRA is, but it is really small. Like most people are not on track for even filling up that first bucket, let alone the other two. So I'd say that's an example of why it's challenging to buy that. And just to answer the question about all of human
Answer the
history.
history question.
No, this is a great question. And so I think people forget that between 1945 to early 1960s, the top marginal tax rate in the United States of America, at its most prosperous time, when our economy grew the fastest and was the strongest, was over 90%. We had an effective maximum wage of about $4 million a year because everything over that limit was taxed at 95%. It was what economists call a confiscatory tax rate. And so I would say the reason why that worked, and by the way, Eisenhower was a Republican president who recodified that code after World War II. It was originally passed because in the war, we just had to have all the revenue we could to, fight fascism, right? And then after the war, people said, oh, should we go back down to low tax rates in the 1920s? And a Republican president and Congress said, no, that actually wouldn't be a good idea because we need to build some highways. We need to build some infrastructure.
Let him respond.
Okay.
I'm curious where you think all the money came from to pay those taxes. This is capitalism. This is where that money came from. Government has never created a dime in their lives. Never.
So
Have
it's
you
the
seen the
people
toll
in
rates for the
capitalism.
main turnpike?
So I think there's probably an ideological thing that we're not going to resolve, but just real quickly, I guess I'd say, I yearn for a different kind of capitalist. I yearn for the capitalist that we used to have, who saw that that making millions and millions of dollars a year was enough, and that they had actually benefited.
It's not a zero-sum game.
Right, and that's what I'm saying.
Never a zero-sum game.
When you pay your fair share in taxes, it makes sure that everybody else has what they need to buy your products, to fuel a strong economy, to keep everything going. And when things get too concentrated up at the top, purchasing power declines, businesses don't do well, and we get stuck in what happened with the
Okay,
financial
this is
crisis.
getting a little.
Read Milton Friedman.
I understand. Yes, my son Alex.
So, I'm more or less, I'm against, this measure for the most part because, like most young men, I came from Scarborough High School. In the general consensus at Scarborough High School was that Maine was a dead-end state. We see no job opportunity. I left for Colorado because I saw little to no opportunity in the state. After college now, I more or less hold the same opinion. I found work outside of the US and France. So after adding this on, what incentive do I have to stay in the state? Because I've already found it very difficult to find a job to stay here, which is why I'm leaving again. And I know most of my peers feel the same way. So adding this tax on, what incentive does it have for me to stay? Because we also, I know I share opinion with a lot, that we don't think we'll ever see this. Like Social Security, for example, is in massive debt because it was pilfered by multiple administrations. It's the largest portion of our federal debt, which doesn't make sense if you have people paying in all the time from an economic standpoint. So my question is really, as a young Mainer, why do I want to support this when historically measures like this will not be implemented in my lifetime, considering how awry they've run at a federal level?
I mean, that's the biggest issue with this is we're gonna lose our youth and those, income earners outside the state of Maine if this is enacted. We actually need to do the opposite. We are the oldest state in the nation. We have a workforce development issue here in the state of Maine that needs to be the #1 priority. Because what we need to do, instead of pushing people away with tax policies such as this, a 1095, we need to attract people. We need to attract, in order to fill the skills that we need here in the state by 2025, we need 58,000 workers here in the state of Maine. And they need to come from, we need to attract them from other states, We need to attract them from other countries, and they may not even look like us, but we need those folks here. But with a tax rate of this level, you know, kids are gonna go to high school, they're gonna go to college, and they're gonna go where they can earn income, but also, you know, where they can keep more of their money. If we wanna attract young families here in the state of Maine, and that's part of a strategy that the Maine Chamber is part of called Maine Spark. It's trying to grow our workforce by 2025, and we're members of it with the university system, the community college system, to attract young people here in the state of Maine. This is the wrong direction for us to head. We need to work together, and I'd love to sit down with Maine People's Alliance and let's work on our home care issue here in the state of Maine, but let's also work together on attracting young people. And we can't do that with the highest tax rate in the country. I can tell you right now, there are folks, there are doctors, that they all come here in the state of Maine, they will hit this rate coming through the gate. Doctors have high student loan debt, but they are gonna make over $128,000 a year. The last referendum we ran on the 3% with education, I can tell you that there were 3 doctors after that passed that did not come here from Tufts University here in the state of Maine. We're a rural state, we need those doctors. And we're gonna send the message out, we're not welcoming. They can go to New Hampshire and are 11% more on that income above 128,000. Massachusetts, it's 5.1%. Vermont is 8.5%. Rhode Island is, I believe, 6.1%. They can go, these doctors that graduate from universities in Boston can go anywhere. We need to attract them, we need to attract young people here. That's the biggest issue facing the state right now, is we're the oldest state in the nation because we are not attracting young people. We also need to attract people from other states and from, you know, different parts of the world.
What's on me?
I keep getting confused. Is this tax on gross income or on adjusted income, this 3.85?
Maine adjusted gross income.
Gross income.
Yeah.
Main adjusted gross income?
Yeah.
So
Yes.
what is that, what adjusts it? What deductions do they get on that?
All your federal stuff. So you know, if you think about your main tax form, the first line is what your adjusted gross income is from your federal taxes. So you put that
So
in.
that's not your wages, that's after you've gotten your property tax and your personal deduction, and that's
So
AGI.
there are deductions that come out of it.
It's your AGI.
Yeah.
As opposed to
Yeah.
like Social Security is on your full wages, this is your regular like income tax on AGI. Okay, thanks, I was getting confused.
And
No,
can
I mean,
comment
that
on young people?
just
Okay.
AGI for businesses, for small businesses here in the state of Maine that.
Well, that's your flow through, you've
Yeah.
already gotten all your deductions
Exactly,
off of
so,
that.
but it is on adjusted gross, so.
Yeah.
Yeah, I think this question is really good. And so just to take this really seriously, you know, if you were to think about Maine 100 years ago, factory work and industry, that was where young people worked. And if you were to think about why do most Maine communities, you know, I live in Lewiston, right? And everybody kind of knows in Lewiston, when you could graduate from high school and find a decent job in a mill, there wasn't this problem of people going out of state to find work, right? And the thing is, those factory jobs 100 years ago were terrible jobs. I mean, they were dangerous, they were dirty, they paid extraordinarily low wages, children were forced to work in those mills. It was only when we as a society, with, by the way, unions and the labor movement playing a pretty big part in this, decided we were actually gonna make those good middle-class jobs. That was a conscious decision that we all had to make. It took unions, it took policy changes, it took a lot of people coming together as communities exercising their democratic rights to make that happen. It didn't just happen, we had to choose it, right? And so today, the home care workforce in Maine is the fastest growing workforce in the state. I don't know where it ranks in terms of age, but my guess is it is predominantly younger folks who are having to fill these jobs, right? And so the reason why I think there are so many people leaving the state is pretty obvious, right? It's not a good deal right now to take these jobs. We haven't, as a society, said care work is a valuable piece of work that you should be able to do with dignity and raise a family on. And when we do make that decision, there will absolutely be these parts of our economy that are growing and growing quickly that young people will want to stay. But obviously, if the best we have to offer young people is a $9 an hour job that is physically and emotionally extremely taxing, and they can find a $20 an hour job out of state that's a lot easier, they're not going to take it. So we have to, as a state, change that. Like, there is no pathway forward out of this conundrum if the fastest growing sector of our economy doesn't start paying better wages. Like there's no
So
shortcut
there's
around
there's
it.
two sides to that coin. Now, I grew up in Westbrook. I was in high school when the mill laid off 2,000 people back in the early 90s. Westbrook was lucky enough, though. They were able to replace those jobs, unlike rural areas, with IDEX. IDEX, those 2,000 jobs literally were replaced by high-tech jobs here in the state of Maine. In order to attract those high-tech workers here, we have a Project Login that's going on. We cannot be the highest tax state in the country. Those wage earners, you know, if you get that degree in high-tech sector and you want to come here to the state of Maine, they'll go someplace else if you have a 10.95% tax rate. It happens. So if we want to grow our economy, we all have the story, if you grew up in Maine, of the mill getting laid off. How do we replace those jobs? I think that's a perfect example of growing high-tech jobs, you know, into the future here in the state of Maine. You look at those types of industries, but we're not going to do it if we have a tax rate of 10.95. It's just a combined household income tax rate.
Okay, we have now a bunch of questions. We'll go around, okay, and then we'll have to call them. Yes.
Could we get all of them out? So in a limited amount of time, we just get them all out and we can respond to them all? Is that
No,
okay?
I really prefer
You're-
to see one.
Okay, all right.
Yes.
Just too much data.
Sure, sure.
You know, I don't even know where to go with this. First of all, I mean, all the 10.95%, I don't know how, Massachusetts has a 5.1% tax. That's a good model. Why can't, I mean, how do we ever expect to be a prosperous state? When you look at some of the high-tech, IDEX, Tilson, all those companies, every one of those companies, everybody has contributed to the snow on one. I mean, it's L.O. Bean. I mean, you asked that question before. I mean, I guess I just know these things because I've been in business a long time in this state. It's how do we ever expect to grow and to be that prosperous state that we can be? We have everything we need here. I mean, we don't want to go back to mill jobs. I mean, I worked in a strange, Ben, I worked in a Wonder Bread factory for 4 years, and then I painted houses for 7 years. I don't want to go back to that. Those young people's jobs that they want to get, I mean, they're out there. So my stepson went to Salt Lake City to get a job in computers. It's the second highest place, and you've got to have a balance. And when you talk about this 800 million, I'd like to know where that went. I own hotels. I mean, at 8.5% to 7.95% or 7.15 is not. I don't get the 800 million, and I know I pay more now because I don't get charity deductions. I give away 6 figures to charity every single year. We all do. I mean, a lot of us do. The Bulluses, I just could go on and on and on. And I guess I don't get it. We should work together. And when you take families at $128,000 trying to get 2 or 3 kids into college, and you call them, those are the people that work for me and manage our hotels. We're missing the whole picture here. I mean, why can't we work together but a 10.95% tax with 1/3 of it going to just one thing, I just don't know how it can work. And then when you read the bill, one last thing, I don't understand why 10 pages of the bill go to things like, if you get 100 signatures from recipients, all the names of everybody in there has to go to a union. And that's why the SEIU was sent, and they do. You can read it right out of the bill. I don't get it. I mean, what are we trying to make the state do, go backwards?
That's a good point, because it deals specifically with the bill. What's the rationale behind that?
Yeah, I mean, I think we've sort of covered this. For people to participate in the elections, they need to learn about the program and be able to talk with each other. So that's what that's about in the bill. And I guess we've talked about this top tax rate. I haven't been able to talk about that yet. And so just the main point I'd make on that is there's a difference between a statutory rate and an effective rate. So the statutory rate is just whatever's on the books. The effective rate is what is the actual dollar amount that you're paying as compared to your overall income. Once you've taken all the credits and the deductions, right? That was your point about the adjusted gross, okay? And so just the important thing to know is once you do all that stuff, sales taxes, excise taxes, income taxes, all that stuff, the top 1% in Maine have an effective rate of 7.3%, right? I think that is a perfectly reasonable tax rate, very, very low in fact, compared to a middle class person who actually has an effective tax rate of over 9% in Maine, and a low income person that's about 8.5.
Well, let me just rebut, just because I pay that, I pay that tax. And when you say the rate's 7.95% on the, or 7.15% of the income tax, I mean, I'll have some deductions in the beginning, but I pay that 7.15%, when we pay that rate. It's not, it's just not, and if you, it's just not the case. And then, of course, the other thing, we might as well just, roll some of these other, the $128,000 you pay into Social Security, you get back, and your benefits are capped. When you pay over 10.9%, that's not closing a loophole, that's money that's going away, you don't get it back.
I think I'm not gonna convince you, and I'd love to respond, but I feel like there might be some
We
other
need
questions.
okay, it's getting.
I'm sorry, I said my piece, go ahead.
Yes.
So then, Chin, question, why the People's Initiative route? I mean, why did this referendum, I mean, it's not a one line, should we have universal health care, go figure it out. It's 11 pages with, I mean, it seems to be all the arguments on no are the devils are in the details of these 11 pages. Why even go this route? I mean, was there legislation that you put in
Yes.
originally, and did not, like, why go the route of the People's Initiative where people can put $300,000 towards a campaign, hit me up at the gas station to get my signature and not tell me what it's about, and then go that whole route, and now it's who's got the most money to buy TV ads and 30-second sound clips? Because look around the room, this is not the whole town. So why even go this route? Why not, why go the People's Citizens Initiative route on this?
Yeah, so I think you kind of answered it in asking the question. So there was other legislation on that. And just Augusta right now is barely able to pass a budget to keep the doors open. They're just not in a position right now to actually be stepping up to lead, to fix real problems at the scale they need to be fixed. So believe me, I missed bedtime tonight to be here with you guys, and I would much rather be home with my kids. But if there were any other route that we could pursue to really do this, we would absolutely take it. And you're right, like, it would be much easier to do this, to write a bad policy that was like just a couple of lines, I mean, way easier. But this is a serious proposal, meant to meet a serious challenge, and so this was the option. So this is why we're going out, making the case, town by town, voter by voter, to have these kind of conversations. And I actually think that exercise of democracy, regardless, is the only way you move forward.
Ken, would you have a comment on that?
Yeah, I think that's the process, and that, I mean, the legislature does pass, I think they passed, 400 or 500 bills of this past legislative session, and they did some things around home care. They did increase direct care workers, the funding for that by $16 million, and they did pass legislation to kind of address the homemaker legislation, to make it more of a vocation, to help a more stable workforce in that industry. And they are, working towards that way, and I think we need a comprehensive plan for that. But this 11 pages that is on this referendum is new. That never had a public hearing in the legislature. We wanted one so we could discuss it. They killed that opportunity. Just to have a public hearing, it was going on the ballot anyway. Let's find out about it. Let's talk about it before the legislature. There was no public hearing on this bill. It's just before the voters for 30-second sound bites. And that's not a good way to legislate.
Okay, we're at, and I promise Nancy we get done.
No, it's it.
Comment here and other hands?
I had a question, but it's okay, it's 8 o'clock.
Okay, one, I'll leave you, Alex, for last. One and other hands? Two, okay, go ahead.
Couple comments. One, I keep hearing comparisons between Massachusetts tax and Vermont tax and New Hampshire tax and Maine tax. You can't compare taxes, income taxes, because they make it up in other areas like real estate. So it's all, it balances out. Everybody's paying for the same things. The summer person who's coming here and getting the benefits and going home more than likely owns property here, and they're paying for our schools. So I don't have a problem with health care for them. And I heard you say, Ben, to your left, right? I heard you say that we need a bill, but this is not the bill. Is that what you said?
No, I did not say we need, I think we need to, as a state, work on, our home care industry, and we have in this past session with 2 pieces of legislation. This is not the solution.
Okay, but where is the other solution?
What? I believe that's the start of it. We're looking at our home care industry, and we're turning it into a vocation so we have a more stable workforce. We're also, I think the biggest issue is funding for direct care workers, and we took the first step We passed legislation this session, even over the governor's veto, that was $16 million. And I think the next legislative session, we take the next step with that. I think that's a solution. It's not this.
Was this bill the incentive for the other consideration?
No, they've been working on that for 5 years, and in fact, I mean, we were there testifying in support of the increase to direct care workers. The Maine People's Alliance weren't there, they brought this forward. We were there advocating for more dollars into the system. We were also there advocating for it to be, to look at our home care workers as a vocation, so there's a more stable workforce. Those are the types of solutions that are gonna get done. This stuff, 30-second sound bites is not the way.
All I know is we don't have a bill, and we need home care, and this is an option.
I guarantee you there will be a bill this session.
I also know that all my life, I have paid Social Security because my income has always peaked at the point where it stops. And everybody else above me was taking money home that I didn't get. This is an opportunity for me to get some of that back.
I never heard you really respond to the thing about the board having any accountability, so if you could just fill us in, and would the board have control over, say, if there wasn't enough money, maybe adding mean testing, how much control does this board have over how it works, and what accountability is there, who elects them, and how does that get changed?
Yeah, I'll do like 60 seconds because I know we gotta wrap.
Sorry, it's late.
Please feel free to use a contact form on the website. There's more information on there, so be in touch. But I would just say this will be the most accountable system there is, because the board has total discretion in terms of program design. So in terms of figuring out if you have this need, what are the set of services that you get, the board designs it. And again, it's a stakeholder group of agencies, workers, and the families that are using the system. So the families are there to kind of make sure the system is as quality as possible. The workers want to make sure the wages are sustainable, to track young people in Maine, et cetera. And the agencies want to make sure the numbers add up so they can actually stay in business doing this. So right now, if you're on Medicare and you don't like the benefit structure, you can't really call anybody, right? But on this, you could, right? Because you have somebody you have 3 people who are supposed to be representing you on the board. And so if there's an issue that you don't like, there's people that you can talk to about it. So that's the theory behind it.
How are they elected?
So real quick with that, I mean, he said it's all discretionary up to the board. That means they don't have accountability to anyone. They're elected, and this is gonna be a 9-person
By who?
voluntary board, but.
Elected by who?
Elected by their constituency groups.
So workers
they're
elect the worker reps,
voluntary.
the families elect the family
And you have
reps.
80,000 people receiving home care services. This is why we have a state government. We have DHHS that answers those phone calls. These volunteers are gonna they're gonna take these phone calls from people that have issues. It's just not, it's not a good system the way this is set up. So these nine volunteers on this board are gonna deal with all these issues when people have an issue with home care. You're gonna call them up to complain, they'll be overwhelmed.
Okay, the only person in this room I can say, make your answer quick, is my son Alex.
Sure.
Our question quick.
Yeah, first, I just would like to ask the man over there, just because the moderator's my father, you don't need to shout down my opinion by accusing nepotism. It's not like he's the president who puts
It's a
kids in
joke.
the council.
It
Still,
was a joke.
still, it's a democratic setting. And the question I had was, in another democratic setting, such as if this citizens initiative moves forward, we have a legislative reconciliation. So you accuse the Maine People's Alliance of trying to shut down a public hearing. But for the more minute details of this legislation, couldn't you address this in a legislative reconciliation to go over these details and present your opinion then and your issues with it? I mean, isn't that what happened last time when they got rid of, for example, the social clubs, which was a major part of the last citizens initiative over marijuana? I mean,
The legislature will have authority to make changes, and I'm sure if this were, and I don't believe it will, does pass, they will. The marijuana law is a perfect example. We passed 30 pages of marijuana legislation that turned into an 80-page bill because there were a lot of issues surrounding whether it be social clubs, and I'm not making a political statement, but when you pass something that hasn't been vetted, they wrote it, and that's one of the problems with the citizens initiative process. One side gets to write whatever they want. It doesn't get fact-checked, it doesn't go to the revisor's office, they get to write the law. We should have a process in place anyway with the citizens initiative that at least the legislation gets written so there's not, these unconstitutional issues, there's not these things. And I agree, the marijuana law changed substantially from what was passed.
Since this is an enormously broad topic, but I will have Ben comment if you want to on this.
I'm sensing a restless crowd, so I feel like it's okay to wrap. I think this might be a good idea.
I want to not only thank our speakers, but all of you for excellent questions and dialogue, so thank you very much.
I have a few copies of the Bangor Daily News summary of some of the funding.
Thank you.
provided.
Appreciate it.
I'd like a
Hey,
copy.
thank
If
you.
anybody
Good to see you.
needs a
It's
copy
always
of
good
the
to
website, I have a few
have
copies of that.
discourse.
It's long, so I didn't make a lot.
Hey, Ben, thanks for coming.
Thanks, good to see you.
Good job.
Thank you.
Ben, I'm glad you came. Full disclosure on the air.
Yeah.
We really want.
Thank you so much.
Okay, all right, I appreciate the connection. All right, thank you, thank you. Yes. Okay, all right, appreciate it, okay. Thanks for being here. Front row seat.
I want to find out that section where we stopped at the red light, as long as it's found, so that everybody really knows.
Okay, all right.